away from it.
Good for you. That is awesome. Anybody else have a story to tell about that?
Oh yeah, I never go.
I do that every day.
Sometimes go to the class and just swing.
Yeah,
A little private screaming?
Go to the class and go to the bathroom and just scream, ah, and come back.
Yeah, there you go.
Come back and
Start all over again.
Yeah, count to 10.
That's
And come
awesome.
back one out.
So everybody can relate to that, a time when, you know, some breathing. You know, when we talked about yoga a little bit earlier,
Yeah.
that I guess you have yoga classes here. so-
Every Thursday.
And so, awesome.
Some of them here do, 10 regularly.
Because yoga certainly teaches us a lot about how to be present, how to bring ourselves into that place where we're going to access our mind the best.
Relaxation.
Absolutely. So, you know, in those moments, Patricia, where it's especially frustrating, you know, using some of those techniques sometimes helps to bring your mind back in the best way it can. Because clearly you've experienced a lot of very difficult situations that have caused a greater tendency to struggle. But somewhere in there, you get how to organize, and you have a method for yourself, and you can use some of these techniques that will help you find that method, so that in that moment of frustration, like Larry said, you know, like taking that breath, or, you know, whatever works for you. Some people, you know, might have a cup of tea, or they might walk around the block. Because remember we talked about walking or moving.
Yeah.
That is awesome for ADHD. That motion actually stirs up some chemistry that helps our brain. So if everybody wants to take another minute just to, like, you know, move their hands or stand up if you want to, whatever you want to do, you know, jiggle it around, you know, boogie a little, you know, that really helps us just get, okay, you know, like the tendency is you're sitting around in a group, you know, you just kind of like after a while you get really tired or you're feeling disengaged. And that can really help. So even if it's, let's say, you kind of have to look like you're looking, it could be like, you know, squeezing your hands a little bit, or, you know, maybe you can't really get up and boogie, but you can also stretch, or, you know, whatever. Those things really are helpful to take away some of that frustration element, some of that, oh my God, I just feel like I'm going to explode. And it's very difficult from my observation. I don't experience ADHD myself, but obviously.
Oh, you never get it.
I hope that I don't. I do have a son, though, who's experienced traumatic brain injury, so I get that. He's
My
always...
brother had it before he passed away. My brother had it, and he was in the military with it. He got it from the military.
Oh, my goodness,
Yeah,
that's
how he got
traumatic.
it. Yeah.
And, you know, there's no doubt that there are residual challenges to that. And that, again, is, you know, that's unique for everyone. It doesn't mean, though, that the brain has amazing healing power. And when we believe that we can make it better, what I've seen with clients is that if you create the belief,
Right.
something that
You believe it.
absolutely, something that you believe inside, that's yours. Nobody
Mind
can...
over matter.
You,
Mind over matter.
Yeah.
Exactly.
you know what my motto is? My motto is, if I can't do it, I will do it.
Good for you.
That's what my motto is. If I can't do it, I will do it. Because I know I can do it. That's why I said I will do it. That's what that means.
You have a very powerful, positive energy.
I try.
That's awesome. What, does anyone else want to share, you know, what works for them?
I have some question.
Yes, absolutely. Oh, tell me again.
Liz.
Liz. See, I told you I wasn't good with it. But I
You
tried.
only get ADHD when you're born with it?
Yes, ADHD is, because it's a neurobiological disorder, it's one that has gone on for a period of time. Now, that being said, you could be born with the chemistry, but not necessarily manifest that much of it. Let's say, you know, you get it from day one, that maybe this kid's got a little something different, and you're really able to nurture that child in a very positive way. That child may never fully express all the challenges. The sooner we can help our children understand how they work, the sooner that we understand how they work, the less likely they are to have significant challenge. Doesn't mean that the ADHD isn't there, but it means that it can be more mild. Now, can we get it later in life? You can have those symptoms, you can definitely have the similar symptoms
That's
from
what I
other
was gonna
things.
say.
Yeah, like the traumatic brain injury can cause a similar outcome. Does it mean that it's a lifelong challenge? I'm not qualified to answer that question, but brain does have an extraordinary healing power, and it's something certainly to discuss with your health professionals about the kinds of things that you can do to really help the situation as much as possible. And a lot of that is the very positive thinking.
I have
Yes,
a question. Is there medication for it?
for ADHD?
Yeah.
Yes, so we've talked a little bit about stimulants, and there are lots of different kinds of stimulants. Some that are short-acting, some that are longer-acting, some that have a stimulant effect but aren't really stimulants. You know, and when we talk about stimulants, the most common thing is caffeine. And a lot of people with ADHD drink a whole lot of coffee because they're, without knowing it, trying to self-medicate. May not be the best solution because we all know the other effects of caffeine, but so certainly that's not a medical way to solve it. But yes, there are stimulants. Sometimes they're combined with antidepressants. Sometimes they're also combined with certain mood-altering, improving chemicals. And that, again, needs the advice and support of a clinician who really understands ADHD, is able to effectively diagnose the individual. Sometimes ADHD is masked under other significant challenges. There might be Tourette's, there might be other mental illnesses where that's present. And so it's very, very complicated, but absolutely can be helped with a combination of medication and the appropriate intervention. And, you know, besides coaching, it might be a cognitive behavioral therapy. Is anyone familiar with what that is?
No.
So there are lots of different kinds of therapies that can be used, and one of them is cognitive behavioral therapy that really, in very much, coaching is most akin to, only it's done by a licensed therapist or a psychiatrist, and it's really helping someone come from their own inside and shift their way of thinking to a place that really works for them. Not where someone says to you, you know, you need to do it this way, or here's a way to color code your notebook. Well, none of us really want to do it someone else's way.
You want to do it your way.
Absolutely. We need to figure out how to do it our way. How are we going to make our life work for ourselves? How are we going to get rid of some of the negative thinking? Or, you know, maybe if someone's just experiencing depression, it's really important to get clinically treated. And when someone experiences depression, there can be a lot of underlying causes for it. It can be the ADHD. It can be something that's just a life-altering event that's caused that. Yes?
You're saying life-altering? I had a life-altering experience. I lost my eyesight,
Oh,
Yeah.
and I got really depressed, and I went to see a therapist.
That's
So when
understandable.
you said about life-altering, whoa, that was life-altering.
Absolutely. And if I have permission to ask, when did that occur?
10 years ago.
That's very traumatic. Anything else you want to share about that?
Hmm?
Anything else you would like to share
Well, like I
about
said,
your experience?
I just, lost my eyesight. I was a miserable human being for a while, and
oh,
got told I was going to get help,
oh,
and I did.
that's good.
And what kind of help do you feel really was the best for you?
I went to a psychologist, and was there for 5 or 6 weeks, like once a week.
And what do you do now to help you?
I come up here 2 days a week.
That's what I was gonna say, that's what helped me, is coming up
I
here.
come up here,
Helps me too.
Yes?
at first, when I first lost my sight, and I was coming up here, they used to have a club, what they call the clubhouse over across the street, and they had to walk me over. And I got to the point where I knew where I was going, I said, let me try it, and I did it.
That's what
That was the
looked at.
biggest piece to me, right there, was being able to do that by myself. Was across the street and find my way to the clubhouse.
That's huge.
Mhm. It is.
Good for you for,
This place has helped me a lot in the last, well, I've been coming up here for about the last 8 years now. This place has been a huge help to me, to help me get my independence. To a certain degree, of course, but
that's awesome. So seeking support
Yes.
outside of yourself and your family, people that can really help you function to your optimal best.
Yes.
And I applaud all of you for being here and really doing something proactive for your lives, because that's awesome.
Mhm.
Because if we're not helping ourselves, you know, who does? And oftentimes when I work with clients, they come to me because they feel very stuck for a variety of reasons. And the very first thing that we work on is creating that balance for ourselves. Because so often we're just not taking care of us. We're overburdened, perhaps trying to take care of other people around us. Yeah, something you want to say, Rosie?
I said, as me, I've been like a caretaker for quite a while. Started off with, caring for my mom, 2000, she had a stroke. And I was a caretaker for 4 years. And then I went from caring from her, for her, and I had a niece with cerebral palsy that, she was like her guardian, because my brother, worked in the prison system and he worked at night, so my mom, kept, my niece, so I cared for her, and so she passed on. She had developed aplastic anemia. And then, I started caring for my uncle, who had sundown syndrome. He had one child, my cousin was his only child, and she worked for, Merrill Lynch. So I was, staying with her dad, during the day, you know, while she couldn't, between me and another cousin. And now, I'm with my aunt who had a stroke. And, it's like trying to find out, you know, to take care of yourself, because I was so busy taking care of other people,
Yeah.
and now I just decided this year, this is what I'm doing for myself, is taking care of me, and whatever happens, because some things you don't have the power over, so whatever happens, you know, it happens, and you know, sometimes they have to deal with it, but you have to deal with yourself.
That's,
Oh, man, Rod, you had it bad, huh?
It's not bad, it's just,
It's just you had a lot of problems.
yeah, it's where you find out is with this generation that
I see
you
what
have,
you're
it's
saying.
enough people to go around to do things, but people are in their self. You
Right.
find out mostly today, and you find out that a lot won't deal with. It hurts me to see our elderly and our very young go through
What you
some of
got.
the things that they go through, and where it's help around them, but people so busy in their own self, you know, they're taking, some take drugs, you know, to compensate, some take alcohol, you know, and they're no help to themselves and they're no help to someone else, you know. And when you see a problem, especially, how I feel about it is like, how can I go out to help somebody else outside when I see something's going on in my family that that they need help and it needs to be taken care of. You know, so I believe in love begins at home first before I can spread it to anybody else.
Yeah,
First, I have to love myself,
right.
and then, you know, you that are around you, and then you can go out, you know. Some things, like I say, I can write a book. Some of the things.
Sounds like it.
You know, I can write a book.
That's really
Yeah, that is.
inspirational, Roslyn. You know, you've really figured out how to balance a very challenging situation that has been dealt to you.
Sometimes I get haywire for me, and I just go to my source of strength, who is, it is the Lord that I believe in. I need help, you know, and I have to, he's like calm me down, and I have to, you know, like, put that aside. Okay, you gotta take it yourself first before you go back and, you know, whatever you have to do with the situation.
Great, so for you, spirituality is a really good
Yes,
source
it's a real good source.
of balance and peace.
Yeah.
Yeah, anybody else want to share what helps them get balance?
You know, I had a slight concussion last year. I fell real high off of the third story step. But I'm alive to talk
Thank
about
God,
it.
thank God.
But
Everybody keep-
what I found that helps me is to now to know my limitations and to keep things simple. You know, simple is like the key, and to be content with what circumstances you're in. So not to like think beyond that.
Right.
So, I say no to a lot of things now. I have a lot of friends, I do a lot of things socially. I'm a spiritual person too, but sometimes it's overwhelming because they want me to go here, do this. I write poetry, write a poem. Sandra's good, like with the entertainment, but now I know my limitations, and now that really makes me more content and more happy with it, because I see a difference since I fell. But I'm fine, I'm good.
Thank God. Everybody give it, yeah.
And she does a wonderful job.
Yeah, she does.
See that?
Yeah, she does. She's always there when you need her.
So
I do singing.
Oh,
you sing.
Oh, good,
Yeah,
don't
my,
break.
you know, I have songs, you know, my heart can sing, so I do that.
Yeah, we were
Oh,
singing
right.
one day, right
Yeah,
there.
yeah.
That's wonderful. That's something I enjoy as well.
Yeah, I do.
Singing is a wonderful
Beautiful
outlet.
songs I sing here.
And we shot till we dropped,
Yeah.
because I
You
bumped
ever
into
see
her.
the movie?
Sometimes I'll take off by myself
Yeah.
sometimes, or sometimes my friends don't want me to do that. Here I bumped into Debbie in the wall. I felt great, I have someone understanding.
That's the energetic work right there.
I can see that. And something that you said, Sandra, that's really important is that you sort of, you know what you can control and what you can't.
Yes, I do
You're
know
letting
now.
go of the sort of what if, because we all do that. We're all like, what if, and driving ourselves absolutely bananas because we're worrying about something that we have no control over. And that's a big thing energetically, when we can kind of, when those things kind of creep up on us, when we can look at it and say, okay, how true is this that I can do something about it? And if I can't, how can I let it go?
No, you can't let it go, because it's not good. You know why? Because if you let it go, it's only making it worse. With the problem that you have, and you know you have that problem, you say, well, I just have to deal with it. Yeah, you have to deal with it, but the way you're supposed to. You gotta go get on that train and say, hey, I'm coming boogie down the tracks, and I gotta do what I gotta do and get this problem fixed.
That's right. So that's exactly it. You do what you can do.
Right.
And whatever you cannot control, which we all know there's a lot of stuff we can't control.
Right.
We can't control that something's gonna happen like that we're gonna fall.
Right.
Right.
You never
You know,
do that.
that
And
an
the first
accident's gonna
question people
occur.
ask you when you fall, how did you do that?
Yeah.
Like you planned it that day.
Exactly.
I
It's like,
said, no, I think I'm gonna go and just fall way up and then let go and then fall.
Well, what do you think? I got a set of wings?
Or how did that happen? Like, well, you know, what happened?
do that.
It wouldn't have happened to you.
And, you know, none of us, you know, would ask to be presented with an extra challenge in our life, but that's the stuff we just can't control, and we just, as people, don't know in our lives what's gonna come up next, you know, what's gonna happen when we leave here. So when we can let go of the thinking about it, that also helps in people, you know, with ADHD, because some are very nervous. That can be part of their chemistry. And so
You're
helping
shaking
them,
all the time?
you know, some people can just be, you know, like worried all the time.
Yeah.
So, that could be